A new non-invasive treatment promises to reduce unwanted body fat in just 15 minutes. Check out these results. These are provided from the company. Of course, we wanted to try it out. So back in the procedure room is Dr. Jason Emmer, his assistant Shay, and patient Monica. And we're gonna put this to the test. But Monica, first things first, I wanna ask, why do you wanna have this done?
I'm an athletic person, health conscious person. I eat healthy, work out 5-6 times a week, but I've always had this tiny bit of stubborn belly fat in my lower abdomen that just doesn't want to go away. So I just thought I'd give this a try.
Dr. Emmer, my friend, 15-minute fat loss. Sounds too good to be true.
That's exactly what I said.
Yes, we're on our way back there, but tell us how it's supposed to work.
Well, this is Trusculpt ID. It's one of the newest technologies to selectively heat and controlled heat the fat so that the fat gets burned forever, permanently.
So Jason, tell me, we're using heat. How is the heat being generated? What type of technology?
So this is radio frequency technology, unlike some of the other devices that you actually have to move and kind of warm up the tissue. This sits on the tissue itself and brings the heat up to the exact temperature needed to burn fat.
I know, Jason, you've seen it. I've seen it. We've done it on the show. We have frozen your fat and melted your fat and moved your fat. Where does this fit in our continual search to beat that fat?
To me, I think is good for localized fat pockets, people that have just that stubborn little bit who really want no downtime, because you know for some of those other treatments, there's some nerve sensation issues, there's sometimes bruising and swelling. With this, you can literally go out that night if you want. You can even go to the gym that day. There's really no downtime to this, so it's great for that person with an active lifestyle who just wants a small improvement.
How much are the treatments?
Well, they can range from 300 to 400 per applicator, and you can do six applicators at a time.
And I know, Dr. Emmer, like myself, we believe in good old-fashioned classical liposuction. Where do you put this in our armamentarium? When are you going to do this, and when are you going to say liposuction is better?
Well, you know, if people have large areas, they really want a lot of contour, you could do the liposuction and then fine-tune it afterwards with things like this so you don't get any issues with the lipo. But those patients that don't want to have surgery, that have small areas, that exercise and diet and just find it really difficult, they can add this to their lifestyle and it would be a great result for them.
So it sounds like patient selection, somebody that's otherwise good shape, talking about small areas of unwanted fat that will probably do best.
This one where you have to come back in a few more times.
Well, each treatment you'll get about 15 to 25% reduction, which is one of the highest in any single non-invasive treatment. So if you want to see more, the more you do, the better you get. Just like going to the gym, the more you exercise, the better result. With this, you're gonna see it in one treatment, but the more you do, the more outcome you'll get.
Well, Monica, we're going to let you finish your treatment and check back in with you later in the show.